Herniation syndromes. What is subfalcine herniation? It is herniation of the brain under the falx cerebra. It compresses the anterior cerebral artery. It is due to mass effect in one hemisphere. This pressure pushes the brain sideways across the midline. Why does the subfalcine herniation happen? It is due to causes such as large hematoma, brain tumor, stroke with edema, traumatic swelling, infection and abscess. Why is the subfalcine herniation dangerous? It compresses the anterior cerebral artery, causing contralateral leg weakness or paraparesis. It also distorts the midline structures in the brain and progresses to deadly herniations such as central and uncal. The key clinical features of the subfalcine herniation: headache, decreased level of consciousness, contralateral leg weakness, behavioral changes and confusion. It can progress to severe brainstem signs, abnormal posturing and coma. CT and MRI findings for subfalcine herniation are: midline shift, cingulate gyrus displaced under the falx, ventricular compression and signs of underlying cause such as bleed, tumor or edema. Management of subfalcine herniation. It is a neurological emergency. Immediate steps include mannitol or hypertonic saline, elevate head of bed, intubation, controlled ventilation, treat underlying cause and ICU monitoring. Thank you for watching. Please like, share and subscribe.